So we're just coming out of Black Maternal Health Week, and last week, Action for Boston Community Development, ABCD, hosted a screening of the award-winning documentary Birthing Justice at the Strand Theater, which discusses the inequality surrounding Black motherhood in the nation. Can you talk about what you took away from that documentary and how it resonated with you both as healthcare professionals?
Yeah, for me, it was a very powerful documentary. I think they did a fantastic job showing what is going on. This is a public health crisis that our mothers, and especially Black mothers, are dying, and their babies are dying. And what I took from it is that 84% of these deaths are preventable, which means that there's a lot that we can do.
Yeah, so what I took from it, especially towards the end, was the focus on abundance, joy, and liberation. Yes, the documentary is about the disparities and the inequities that are happening around Black maternal health, but we also need to remember this is a very special moment. People are having babies, bringing babies into the world, and it's very important that yes, we address the disparities, but also focus on the why. Let's bring it back to the joy, the abundance, the love, the sacredness of birthing.
I think that's an excellent point. It's about remembering the joy, and this should be a beautiful time in a Black woman's life, and we have to make sure that she's sufficiently supported.
Yes.
I'd love to talk more about ABCD. It's actually made history. It was one of the first, along with the University of Tufts, to establish the very first health center with the Geiger Gibson Community Health Center in the nation in 1965. ABCD is also a Title X recipient. Frinny, I'd love for you to talk a little bit about what it means to be a Title X recipient, and what do you make of reproductive health justice in light of our current situation in the country?
Yeah, so ABCD is a community action organization providing services to many, many Boston residents, and actually in the greater Boston area. And we touch upon about 100,000 residents per year. And with the health services, which is the area that I'm the medical director for, I will say somewhere around 30,000 people. And we provide family planning services to the community. And I think that it's really important that people know that we're doing this because we do a really good job at it. We've been doing it for so long, like you mentioned, and we want to make sure that our residents are getting the information, education, and care that they deserve in order to have, for example, a healthy pregnancy.
And speaking of healthy pregnancies, when we're looking at the statistics for Black women are 3 to 5 times more likely to die from pregnancy complications than white women, according to the Population Reference Bureau. Can you talk a little bit about some of the systemic factors that are driving these statistics?
Sure. So it's multi-tiered, right? So we know that Black women are experiencing cardiomyopathy, elevated blood pressures, right? Preeclampsia, hemorrhaging, all these issues while pregnant and having their babies. But the major factor is the social determinants of health, right? What is happening before this person is pregnant? What is happening in the community? Do people have sufficient housing, safe housing, right? Is it a food desert? Are moms able to get good nutrition for themselves and for their babies and while they're pregnant, right? All these things are factors that complicate pregnancy, and those issues aren't necessarily being addressed. So when folks now come in to have their babies, they're experiencing these disparities.
And then I'm very curious about this report, a 2023 report that came out of the Boston Public Health Commission. It showed that the highest rates of infant mortality are in Hyde Park, and with Mattapan and Dorchester leading the city in low birth weights and preterm births. What do you make of these findings, and how can the city of Boston work to help improve these health outcomes for Black mothers?
Yeah, it goes with the literature that has been showing that Black communities are the most impacted by deaths related to pregnancy, complications, and infant mortality. And I think it's really important to know that this is related, like Tiffany was saying, to social determinants of health, but also structural racism, which we have seen that biologically, there's no difference between races. Races are social constructs. So what is it that is causing Black women to die at higher rates and their babies than white women, for example, or white babies? And we have to look at that information and see in Boston what is impacting that. Like she mentioned, housing, having racism, experiencing that, and having the stress that comes from that is also something that impacts them. And we need to go to those communities and ask the residents to work together with the community to see how we can improve their health, their access. Social determinants of health actually impact health more than going to see a doctor. 60% of someone's health is dependent on these things. Do they have housing? Do they have access to foods? Are those healthy foods? Do they have education? And the research has shown that even with same amount of education, same amount of food security, Black women still are fare worse when it comes to their maternal health.
Yeah, we need to call community members to the table and ask them what they need, right, to live well, to flourish within their community. The people closest to the problem are closest to the solution. We can't create the solution for folks. We really need the voices to figure out how we can fight these disparities.
And can you tell us more about the work happening at Neighborhood Birth Center and ABCD that's happening to support our Black mothers?
Yeah, so very, very exciting news with Neighborhood Birth Center. We actually just closed our capital campaign. We raised $3 million from small donors over 18 months. We have land in Roxbury at 14 Winthrop Street. We're very excited about that. We hope to be breaking ground sometime this summer. We started workshops in the fall, Empowered Birth, for birthing people or people wanting to become pregnant. And we teach topics such as what's informed consent, what's trauma-informed care, what's equity, what's access, what's reproductive justice. And this spring, we actually expanded our workshop offering with a grant from the City of Boston for $50,000. So now we have a 3-part series of Empowered Birth, a 3-part series of Postpartum Power, and we have Empowered Health, which we offer to partner community organizations. And in the summer, we will be offering Empowered Birth in Haitian Creole. So we're wanting to educate the community. What does it mean to advocate for yourself, right? What does it mean to go to your visit and be well informed about your pregnancy, about yourself, and about what you need as a birthing person? And we're wanting to share this across all of Boston, across all of Massachusetts, really. And we're excited to be able to offer this to the community free of cost. There's one birth center in all of Massachusetts. Cambridge has closed, Beverly has closed, and we're really looking forward to opening our doors and welcoming people in, not just for birthing care, but also care across the reproductive spectrum.
That's so exciting. And speaking of advocacy, how can Black women advocate for their health now, especially in the early phases of their pregnancy?
Yeah, the one thing I will say is that at ABCD, in addition to putting community events such as the screening of birthing justice, we provide family planning services, like I mentioned earlier. But in addition, we address all those points that we talked about, social determinants of health. So we start with education, all the way from Head Start to elderly programs. We have services that provide people with resources in terms of food security, in addition to immigration services, different services that we know will help a woman, to be as healthy as possible and feel as supported as possible in order to go through this process. What I will say in terms of advice is to advocate for themselves. I think that a lot of what has happened is that many of our Black mothers don't feel that they have been heard. And when they are speaking, they're ignored. And I want to make sure that to let them know, keep asking. And if it didn't hear you in one place, go to another place. Because you know your body more than anyone does. You know, as a doctor, I can tell you, I try to learn as much as about my patients as possible, but they know their bodies better. And if you think something is wrong, then you can go to another place until you're heard.